Hello, everyone. Today, we're diving into an incredibly important and essential topic in our lives: stroke and effective treatment methods. Stroke is a dangerous condition that can lead to severe and life-altering complications if not treated quickly. But with the right knowledge and understanding, we can protect our health and help our loved ones prevent and treat stroke effectively. Today, we'll explore in detail the causes and development of stroke, emergency treatments, the rehabilitation process, preventive medications, surgical options, and lifestyle changes that can all contribute to improved outcomes. Join me on this in-depth journey as we learn more about this critical topic. To understand stroke treatment thoroughly, it's essential to look closely at the causes and disease progression involved in stroke. A stroke occurs when blood flow to a specific part of the brain is interrupted or severely reduced, causing brain cells in that area to lose access to oxygen and nutrients. When deprived of these vital elements, brain cells can begin to die within minutes, leading to permanent damage if immediate action is not taken. Strokes are generally classified into two main types: ischemic stroke and hemorrhagic stroke. Ischemic stroke. This is the more common form of stroke, accounting for roughly 87% of cases. It occurs when a blood clot or blockage forms in a blood vessel supplying blood to the brain. The underlying cause of these blockages is often atherosclerosis, a condition where fatty deposits or plaques build up on the walls of blood vessels, causing them to narrow and eventually become completely blocked. When a clot forms at the site of these narrowed vessels, it can obstruct blood flow to parts of the brain, resulting in an ischemic stroke. Hemorrhagic stroke. This form of stroke is less common, but more dangerous and can result in more extensive brain damage. Hemorrhagic strokes occur when a blood vessel in the brain ruptures, causing blood to leak into the surrounding brain tissue. This type of stroke is often due to high blood pressure, aneurysms, or other vascular malformations. The pooled blood from the hemorrhage increases pressure inside the skull, leading to rapid deterioration of brain function and potentially widespread tissue damage. Understanding the different types of stroke is crucial because the treatment methods vary significantly depending on the cause. Now that we have a solid understanding of how strokes happen, let's look at the various treatment approaches. When someone suffers a stroke, emergency treatment is the first and most critical step. Immediate medical attention is essential to minimize brain damage and improve the chances of a full recovery. The approach to treatment depends on the type of stroke diagnosed. Let's explore each method in detail. For ischemic stroke, the primary treatment for an ischemic stroke involves dissolving the clot that is blocking blood flow to the brain. This is typically done using a thrombolytic drug, often known as a clot buster. The most commonly used drug for this is tissue plasminogen activator TPA, which can dissolve the clot, restore blood flow, and reduce the extent of brain damage. However, TPA is most effective if administered within the first 3 to 4.5 hours after stroke symptoms appear. Beyond this window, the risk of bleeding may outweigh the benefits of the drug. Additionally, for larger clots or cases where TPA is not sufficient, doctors may use a procedure called a mechanical thrombectomy. In this procedure, a catheter is threaded through the blood vessels to the site of the clot, and specialized tools are used to physically remove the clot from the artery, restoring blood flow. This procedure has been shown to be effective in reducing long-term disability from stroke. For hemorrhagic stroke, in cases of hemorrhagic stroke, treatment focuses on controlling bleeding and reducing the pressure inside the brain. This may involve medications to lower blood pressure and reduce brain swelling. Doctors may also use medications to prevent blood vessel spasms, which are common after a hemorrhagic stroke and can further restrict blood flow. In more severe cases, surgery may be required. A procedure called a craniotomy, where a part of the skull is removed temporarily, can help relieve pressure on the brain. Additionally, if the bleeding is due to a ruptured aneurysm, doctors may use procedures like endovascular coiling or surgical clipping to stop the bleeding and prevent further damage. Once the immediate emergency is over, the journey of recovery and rehabilitation begins. Stroke recovery varies greatly among individuals and can be a long-term process, depending on the severity and location of the stroke. Rehabilitation aims to help patients regain their physical, cognitive, and emotional abilities to improve their quality of life. Physical therapy. This type of therapy is critical for regaining lost motor skills, such as walking, balancing, and using one's arms and legs. Physical therapists work closely with stroke patients to design exercises that improve muscle strength and coordination. They might start with basic movements and gradually progress to more complex exercises as the patient's abilities improve. Occupational therapy, for patients who struggle with daily activities such as eating, dressing, and bathing, occupational therapy is an essential part of recovery. Occupational therapists teach patients strategies to adapt to their current abilities, allowing them to be more independent in daily life. Speech and language therapy. Many stroke survivors have difficulty speaking, understanding language, reading, or writing. Speech and language therapy helps patients relearn communication skills using exercises and techniques that encourage them to practice speech and comprehension in a structured way. Psychological and emotional support. Coping with the aftermath of a stroke can be overwhelming. Many patients experience depression, anxiety, and other emotional challenges. Psychologists or counselors play a vital role in helping patients process these feelings, improve their mental health, and build resilience for the recovery journey. Even after successful treatment, the risk of a second stroke remains. Preventive medication is crucial to minimize this risk, particularly for those who have experienced an ischemic stroke. Here's an overview of the primary medications used in stroke prevention. Anticoagulants and antiplatelets. These are medications that prevent blood clots. Anticoagulants, like warfarin, and antiplatelets, like aspirin, make it less likely for blood clots to form and block blood vessels. Regular blood tests are often required for patients on anticoagulants to ensure the correct dosage and monitor any side effects. Cholesterol-lowering drugs, known as statins. These drugs help reduce cholesterol levels, decreasing the buildup of plaque in the arteries. Lower cholesterol levels reduce the risk of blockages and can play an essential role in stroke prevention. Blood pressure medications. High blood pressure is one of the most significant risk factors for both ischemic and hemorrhagic strokes. Medications to control blood pressure, such as ACE inhibitors and beta blockers, help maintain a safe range and reduce stroke risk. Patients are advised to work closely with their doctors to monitor their blood pressure regularly. In some cases, surgical interventions may be necessary to prevent future strokes. Here are some of the common procedures. Carotid endarterectomy. This surgery removes plaque buildup from the carotid arteries in the neck, which are major blood suppliers to the brain. By clearing these arteries, blood flow to the brain is improved, reducing the chance of a stroke. Carotid stenting. In this procedure, a small metal tube called a stent is inserted into the carotid artery to keep it open. This method is especially beneficial for patients with narrowed arteries who cannot undergo endarterectomy. The stent improves blood flow, which can help prevent a stroke. Aneurysm repair. For patients at risk of hemorrhagic stroke due to an aneurysm, doctors may perform endovascular coiling or surgical clipping. In endovascular coiling, coils are inserted into the aneurysm to block blood flow, preventing it from rupturing. In surgical clipping, a small metal clip is placed at the base of the aneurysm, cutting off blood supply and preventing a rupture. Beyond medical treatment, lifestyle changes and diet adjustments are vital for preventing future strokes and enhancing overall health. Dietary adjustments. A balanced diet with plenty of vegetables, fruits, whole grains, and lean proteins is highly recommended. Limiting salt, sugar, and unhealthy fats helps manage blood pressure and cholesterol levels. Foods rich in omega-3 fatty acids, like fish and flax seeds, are known to support heart health and reduce stroke risk. Regular physical activity. Exercise has a wide range of benefits, including improved circulation, lower blood pressure, and better heart health. Simple activities such as walking, swimming, or practicing yoga can strengthen the body and make it more resilient. Avoiding harmful habits. Reducing or eliminating smoking and alcohol consumption is crucial. Both of these habits contribute to plaque buildup in blood vessels, narrowing arteries, and increasing stroke risk. Staying tobacco-free and limiting alcohol intake significantly lowers the chances of future strokes. Stress management. Chronic stress is associated with high blood pressure and other risk factors for stroke. Techniques like meditation, deep breathing, and mindfulness can help reduce stress, contributing to a healthier lifestyle and lower risk of stroke. Regular health monitoring. It's essential for stroke survivors and at-risk individuals to monitor their health regularly. Routine checkups help in tracking blood pressure, cholesterol, and overall cardiovascular health, allowing for timely intervention if needed. So, there you have it, a comprehensive look at stroke treatments. from emergency responses and rehabilitation to preventive medications, surgical options, and lifestyle changes. While stroke remains a serious condition, proper treatment and a healthy lifestyle can help survivors improve their health, prevent recurrence, and live a more fulfilling life. I hope this knowledge empowers you